Hi, this video is the art of hair transplant restoration surgery. Before we're gonna start it, so this is day 0, and right before we enter surgery, Joseph, he's kind enough to allow me to show you, to film the full face, and we're gonna do the follow-up too. Despite the fact that Joseph's from Chicago, but he's willing to come. Okay, he believes in my work, and he's seen quite thousands of the before and after. And he mentioned that he watched my channel quite frequently. And if you subscribe to my channel, every Friday I upload new video. Because for me, I take pride in my work, and one of my inspiration is, and what separate my work from a lot of clinic is the artistry of the hairline. Because you don't want to have hairline. You want to have hairline that looks so natural that no one know you have had surgery. And then the density is given, and so I'm very happy for Joseph, and I'm very confident that we can give him a very natural look, and he's gonna look different. You can see his face change, the transformation change. And so we're gonna do 6 months, Joseph, right?
Yeah.
And then and a year follow up, and you can see the density and the face will change, and we'll want to bring back his handsome face, because hairline, when you have a perfectly recreated and restore, it frame the face better. When if by I mean what how you say frame the face, we can make the whole face proportional. When it make the face proportional, then it enhance the looks, the eyes, the nose, and all the features. So when I build the hairline, I build according to each individual facial structure. So for Joseph here, I don't do the measurement first. I just build around his facial structure. I want to make sure it's a third and a third and a third and a third. And then we gotta make sure we bring the tempo as well, you see. And we did that on both sides. So when he wrinkle, the highest crease is right around here, and we put a finger breadth slightly on both sides, and then you can relax. And then so that way we know that it's a mature hairline, and so initially I drew it slightly higher, and I asked him, what do you think about the hairline? It's the chance for you to change now before we come in, because once I make the site, so put them in, it's hard. And and for me, I always want the patient opinion, because the more I found out that the more patient that give an opinion on what the hairline is, the more satisfied they are with the hairline. And then together we work together to give them the best natural look. So once we get the shape down, and again, the Caucasian tend to have a little bit more narrow face, so we arch up a little bit, and you can look down and see it's a little bit arch on both sides. And then once we get the shape down, we will transplant 35, 45 in the front. It increases when you go backward, and change it when you go different direction. The temple tend to have a root that goes single hair, because the temple are not for density, it's for framing the face. So we put a single root and flat and point it backward. So the angle selection the angle is important. Selection of hair grafts is important. So we try to find rows and rows single hair grafts in the front, followed by root to go 2, 3, and 4 hair. But in the old day, we put the gradient. Nowadays, we want to make the density more up front. So then we mix 3 and 4 right behind many rows of single hair graft with the 2s. So that way it will get a appear of density. And then I went over with Joseph about the 4 type of hairline, right? We went soft, medium, medium tight, and tight hairline. In terms of those are the zigzag. And the zigzag I've been talking for years, so it's been 15 years. It's important because initially people were saying, what the heck is that? It looked like a spoke, But I say you don't base on right after surgery. You base on when it comes out. So the soft hairline, the zigzag is really big, and those are for more older patient, because they want to not draw a lot of attention. They okay not to looks not that dense. So the drawback is it doesn't look that dense. And then I went over with you about the tight hairline, right? Mm-hmm. The tight hairline has very tight zigzag. So then it brings a lot of density appearance. The hairline look really sharp, but it draw a lot of attention. So those are more for celebrity. And then most people, I'll tell you, over 95% are for either medium, tight. And so basically the medium has, for a guy with thicker hair, so then you have a good amount of zigzag, but tight enough to give you density. But the softer hairline, the fine hairline, you also have very thin hair. So his hair is like half of my diameter. So then we push the limit of density by having a little bit tighter hairline, so called medium tight, and but without drawing attention because we don't want to do tight hairline. So we're gonna settle on for Joseph a medium tight hairline because he have a thin hair, but it's still gonna give him very good density. I'm excited for him because he's gonna look different. He's gonna gain his knowledge, his youth, but his handsome face back. And he's kind enough to allow me to show the full face, and we will see in 6 months. Okay.
That's it.
Stay tuned. Bye bye.